Hello, hello, Bougie girls. How are you all doing on this Monday evening? We are here with Healthy You Corner, and we are super excited on tonight. We have a doctor with us, so prepare your questions. Come and be ready to ask questions of her, things that you're kind of nervous about, you don't know what to ask when you go to the doctor's office. She is here to assist us with that and just to give us some great information as Black women in our health. So we have Dr. Shaughanassee Vines, a certified nurse midwife, is an alumnus of Old Dominion University, where she earned both a bachelor's and master's in science and nursing. In nursing, she received a midwifery education at Shenandoah University and later earned her Doctorate of Nursing Practice degree from Frontier Nursing University. She is the owner and founder of Coceaux Health, I hope I said that right, telehealth platform pairing Black women with Black health providers. Dr. Vines has spoken at a variety of events across the country. Aside from her career, she has a loving husband and family and serves within a number of community organizations. She enjoys traveling, spending time with loved ones, laughing, and making others smile. So let's welcome to our Bougie Girl platform, Dr. Shaughanassee.
Hi.
Hi,
Hi,
Dr.
ladies.
How are you doing?
I'm doing very well. How are you doing?
We are awesome and thank you so much. We are honored to have you with us tonight. And then how do you pronounce the name of your organization, Cocoa?
It's Coco, so it has
Oh,
the different spelling, but it's Coco. So on that brown girl
nice.
magic there.
That's awesome. And so, Coco may be referring to women of color, or is that why you chose that name?
And exactly, exactly. So for all of us on that color spectrum, the
Yeah.
main premise of our business is to really serve women of color, because as we could see from all the health disparities, that we are affected in ways that other women are not in so many different areas. So I wanted to be able to serve my community in that aspect, being a woman of color myself, and to give back and to educate. So that's what we do at Coceaux Health. We provide telehealth services for women of color, as well as content and a sense of community. So if anyone wants to write, then they are welcome to reach out too.
Awesome. I love that name, Coco. Just you embracing and loving on us as Black women, because I'm in my 40s, so I've noticed throughout my years of finding a doctor, it's just been such a challenge, no matter what state I live in, finding a good African American doctor and kind of being a little shy about asking, is this doctor Black? And like oh, well, we can't tell you that information, and you having a desire to have someone that looks like you. So this is such a blessing to be able to, for you to even want to do this. And what was your passion behind? I know you were saying because you're a Black woman. What else led you to start your organization?
I think it took me a while to really embrace who my audience was, and I always like to say my loyal ladies, because I've been in
Yeah.
practice for a couple of years, and it just kind of one day dawned on me. I said, who are the people that I'm really serving? Of course, you're in this to make a
Right.
difference. Of course, there are lived experiences that I have as a Black woman as well. And then it just started to dawn on me that my patients and we connected on those levels about hair in the visits, about care
Yeah.
we've received in the past, about things that we relate about, how we um, experience pain, how we tell others about, our business, but letting our walls down so that way we can share different health conditions. And so I really decided just to put it out there and serve who my audience has always really been women, especially women of color. I definitely have served women
Right.
of all ethnicities, but just
Yeah.
seeing all of the news and all the disparities, we've always known that they were there in healthcare. And now I'm glad that they're making the forefront and everyone is becoming more aware. So that way we can do better. And so that's what Coceaux Health does. That's what I do. I just want to, again, provide that service. And the last thing I'll say about my passion is
Mhm.
that you never know, I guess, until someone tells you something. And it sounds really
Right.
basic, but it really is the truth. So I've met so many women who say, you're the first person to ever take the time to sit and educate me about that, talk to me about that.
Right.
And that really, it makes me a little sad for the healthcare industry, because we are supposed to be the ones that advocate for patients, that listen to patients, that teach patients.
Right.
And so for me to hear that, it lets me know that people aren't stopping to have those conversations.
Mhm.
And I want to be able to have those conversations with the ladies that I serve.
right, to take the time out and actually listen to them and not
Right.
pushing them through and rushing them through their appointments. Because I know a lot of times I felt that way, like I'm feeling rushed through my appointments, like I'm not able to really just, you know, be vulnerable or just let you know this is what I'm really dealing with, and for them to really actually care and, you know, care about my pain or, you know, me not knowing for sure what's really happening with my body.
Exactly. I mean, it's all about relationship. I always say, working in women's health, especially, if I'm going to be in women's most sacred or vulnerable areas and talking to you about your health, which is very much private for all of us, then we got to have
Right.
that relationship. So
Yeah.
I have relationships with people who do my hair. I have relationship with the people who do
Yeah,
my nails. We have relationships with our girlfriends. So you
right.
definitely have to have that relationship with your healthcare provider so you can have an honest relationship there, have healthy dialogue, and can really get down to the bottom of whatever is ailing you or get that education that you need.
Right. What have you found to be most, I guess, challenging or the most challenging questions you've been hearing, I guess, in the past, you know, since you started your business with women of color in healthcare?
I think a large part of it is feeling listened to, like we talked to before. So I definitely try to always have that listening. I've had many patients say that, you know, such and such didn't talk to me about this, or such and such didn't explain to me. And so one of the things that I always encourage women to do is to ask questions. I
Mhm.
always tell people that I am not like the end all be all. I know about the things I know, and then for what I don't know, I know people who do know. But I always love it when people ask me, what should I do, or who can I talk
Right.
to, or are you sure this is safe? And so I'm
Mhm.
always of the persuasion of, let's have a conversation about things. It's not me or any healthcare provider shoving advice down your throat saying that you should do this, you will do this, but it's about, these are the options. What do you feel comfortable with? What do you think is going to work for your family? So I definitely think being listened to, being heard, being valued and seen is big, just for women, period, but definitely for women of color. And then also, I think just trying to make healthcare or the health tips culturally relevant too, especially when we
Mhm.
think about things like diet, when we think about things like
Right.
weight loss and size. So
Right.
how do I make sense for my life? How do I make of this for my family or for my children, or
Yeah.
all these different things, And so I think that health has to be very much individual, has to be specific. And then
Right.
that's what that visit is for, to find out who this woman is and to find out
Mhm.
how she fits in that health continuum. And then what we can do as, I would like to say, partners, to make
Right.
sure that she's the healthiest person that she can be, that she feels comfortable being.
Right. And so I just want to remind our audience, we're talking to Dr. Shaughanassee Vines, and she is giving us the lowdown on healthcare with women of color, and she's answering your questions. So if you have some pressing questions, you know, she is located in the Cali area, in the California area. So all my Cali girls out there, if you all need a healthcare provider and you're looking for a Black doctor, or you need to be connected to someone that looks like you, please feel free to reach out to her. We're going to give her information at the end, so to give you ways of how to connect with her. But I know I see on your blog you have so much vital information, and I know you talk a lot about vaginal health and different things like that. Um, I know you have a blog that says, or a post that says, what is your vagina telling you this year? Can you kind of talk to us a little bit more about that, or why you made that post?
Sure. So I always, I just love having these conversations with people. Every time I go to a conference, every time I speak, like, these are the number one things that I talk about. Because I think as women, we
Yeah.
just need to know, our
Mhm.
moms teach us thing, grandmas teach us thing. And I didn't realize some of that stuff that I was taught wasn't necessarily the right thing until I was in a master's program. And
Wow.
so
Mhm.
I just really want to spread that information, because we don't always get that information. So the top couple things that we talk about in that blog post, so just a few tips, and then hopefully everyone goes and checks it out. But little
Mhm.
things like being sure that you're using the right products in your vaginal
Mhm.
area. Many women know about the infamous odor that happens, bacterial vaginosis, BV,
Mhm.
as we like to call it.
Right.
Um,
Mhm.
it's such a pain, and a lot of women feel embarrassed about it. They feel like it comes all the time. It's very frequent, and they feel like they don't have much control over it. And so we talk about some of the things that women can do at home, so that way you can feel like you're taking control of your health. So things
Right.
like not using scented soaps, when you're washing in your vaginal area. You don't want to make sure, or you want to make sure rather, that you're not washing inside, but you're just letting the water hit the outside. And that goes against a little bit of what some of our moms and elders and godmothers and moms taught us about, get all of that. But your
Right.
body really doesn't need that. Your vagina really doesn't want that. Your lady parts, as I like to say, they look at it like, I don't know what you are. Let me stay away. And so all those symptoms that we have is your body's way of saying, I'm a little off. My pH is off. My balance is off. I don't know what's going on here. Simple
Right.
things we can do, like just using water. The clothes that we wear, the leggings are in, the skinny jeans are in. I like a nice, well-fitting, I'll say, pair of pants. And especially for us curvy girls, we got the
Right.
thick thighs and all those type of things. So
Mhm.
if you just wear the right material that can allow air circulation, and allow you to have maybe less recurrences of BV or less yeast infections, wearing
Mhm.
cotton underwear really helps. Sometimes just not wearing underwear at night, things
Right.
like that. If you're coming from the gym, or if you're coming from that workout, taking those wet clothes off as soon as you get in the house and not saying, oh, let me
Right.
stop at the store. Let me stop here. Let me sit in my car and
Oh,
scroll on social media or talk on the phone. All those things that I'm guilty
right.
of doing too. But just
Right.
go in the house, getting some dry clothes, and that cuts them down on infections too. So just little small tips that we as women can do every single day, small changes, but that may make a world of difference for some people.
Right. I have a question. I know when you're on your period and you're talking about not using soap, are you saying just anytime don't use soap and because I mean, for me, I'm like, I don't feel fresh, if I don't use any type of, especially during that time. So
Mhm.
is it good to use, is there any type of soap or any type of cleanser that we can use, especially during that time?
The main thing, so water is always your best friend. The main thing is you don't want the soap to really get inside. And so to make it easier, most times it's just easier just to use water. I tell people by the time you lather up top, you lather down below, and then you allow the water to rinse, some soap is going to hit that area. So it's not like it's been completely neglected. Even if women have like the detachable shower heads where you can take it
Mhm.
off and actually put the stream of water there, then sometimes that helps, especially during that time of the month too. Of course, there are
Mhm.
lots of different products out on the market. Some work better for some women better than others. So I always tell people that's really a individual choice. If you notice
Mhm.
something has been working for you and it's very mild, it doesn't give you any irritations, and you've been using this for 10 years, let's say,
Right.
and you're doing okay, then I'm not going to, stop what's going on. But if you're noticing, well, it keeps coming back and I keep having these symptoms and I get a little irritated, well, maybe, it's from the soap. Even things like Dove, I've heard of people that typically are it's a sensitive, milder soap, but in those particular regions, that
Sure.
skin is just very sensitive. So just, the water is great. If you could actually, rinse some water there, it's fine. But, if you have like a particular wash that you use or refreshener that you use that is just for that time of the month and you're doing okay, then I think it's okay to stick with that.
And I'm a Dove fan. I've been using Dove like forever, like 10 years, like the sensitive Dove. And,
Mhm.
I don't know, I guess I've always thought that I needed to use soap in that area, but, just to kind of feel, better, like you said, after working out or whatever
Mhm.
case
Mhm.
may be. And so, I just want to let our audience know we are accepting questions because they're asking, are we taking questions? Yes, we are taking
Sure.
questions. Dr. Vines will answer your questions. And so, one last question for myself, because I know Elena probably has some questions. I'm being a greedy right now. Um, I wanted to ask about pH balance because I've noticed, I think my pH balance gets off a lot. And so are some healthy ways for us to balance or continue to have our pH balance? So,
So definitely, like we talked about with the soaps, making sure that things don't get internally, that they stay externally. those things can help. The more sexually active people are, that's just bound to change your pH a little bit, just because it's someone else's skin touching, a very sensitive part of your skin. So some of those things just happen naturally. But also diet, plays a really big role also in just our body overall. But our vaginal health is connected to our overall health. So the things that we put into our bodies and we eat, those make a big difference. So just making sure that you have a pretty balanced diet with enough vegetables, healthy fruits, complex carbohydrates, and not like the simple sugars. Even in my experience, women have told me that it helps when they can cut down on some of those sugary foods or starchy foods and eat more of a whole food diet, or more of a well-rounded diet, that they can see those improvements even in their vaginal health too. So things like that, like the things that you put into your body, the foods that you eat, making sure that you cut down on these extra sugary drinks and things that we do. The washing we talked about, all of that helps out with the pH.
Okay. And we have a question here from Jen. She says, does the vaginal area change in texture as you get older?
It can. And so I always like to think of it like this: just as like the skin on the outside of our body and your hands changes as you get older, skin down there is still skin, does the exact same thing. So it's not as stretchy as it may have been. Sometimes colors change, hair textures may change. What we call elasticity, so how much give and wear and tear it can have, all of that changes. So we definitely want to make sure that you're careful in your vaginal area just at all times, because it's a sensitive area. But sometimes when we get older, things that may not have bothered us when we were younger, it may bother us now. So things like intercourse, that friction. In your 20s, it may not bother you at all. But when you get to your 40s or your 50s or your 60s, that same friction, it may bother you in a different way than it would have before. So all that to say, yes, the skin in your vaginal area, it does change. In the medical world, we call that atrophy, meaning it loses some of that stretchiness. So as we get older and our regular bodies change, our vaginas change too.
Yeah. And so is there anything that can be done? Like, because I know I'm hearing people doing vaginal rejuvenations and all these other things. If that stuff, does that really work? Or, I mean, I don't know. It just...
So everyone has different thoughts on that. So we'll start with atrophy, just the process of the skin changing itself. Know that that is a natural process. So if anyone's saying, oh, that's happening to me, it's happening kind of everywhere. Everyone's just not talking about it. So that's a natural process. Again, you want to make sure that you're hydrated, that you're drinking water. But sometimes even the most well-hydrated people, those things just happen. There are things over the counter like moisturize, Replens, moisturizers, other different products and name brands. They have what's called like vaginal replenishers. And so it's supposed to give you some of that moisture back. It may not make it like, voila, overnight, but it makes things like intercourse, a little bit easier. Or some women, because they lose some of that stretchiness when they enter into their menopausal years, they may notice that they get more things like UTIs and stuff more frequently. So sometimes it could help in that aspect as well. And then with the yoni steams and the vaginal steams, they have so many different names. Like I said, different people have different viewpoints on them. I'm of the viewpoint that it's kind of like a nice facial for your vaginal area. So for the skin in that area, I just tell people when you go, have realistic expectations. So will it take your fibroids away? Probably not, just because it's not reaching the uterus where your fibroids are. But does it make you feel refreshed? Sure, some women have said that. Does it make you feel like your skin's in better condition? Some women have said that too. So just making sure that they're not having herbs that maybe irritate your skin, because if you have an allergic reaction in your face, you don't want to have one in your vaginal area. And if you get burned on your hand, you don't want to get burned down there either. So just be careful when you had those procedures, and ask away. Like we said before, just ask the risks, the benefits, what people have said. And if you feel comfortable with that, then by all means continue. And if you don't, then that's okay too.
Yeah, we actually had a vaginal steam practitioner on here a few weeks ago. So we got a lot of information from her, but I'm glad to hear you say that. It makes me feel a little more easier, like to
Yeah,
find the right person, because I wouldn't
sure.
want to do
Right,
it by myself at home.
Right. 'Cause
right, right.
mhm,
Like,
She was
mhm.
explaining that the herbs that they use, make sure that they're natural herbs and not the packets that people with the chemicals in it, because
Yeah.
that can
mhm.
affect you as well. So
Yes, yes, yes.
that was some good
We have
information.
another question.
Yes.
She says, "My period is very irregular. How do you regulate your period without birth control? For example, I become a week late and then a week early at times."
So this is not to replace the advice of your medical provider, because something like that, honestly, first of all, I would encourage go be seen for that. There can be literally lots of different explanations as to why some periods are regular and some are irregular. So if you haven't gone to be seen, first of all, make that appointment to be seen. For some women, I've seen that kind of just happens with their cycle. As long as they're getting that monthly cycle, it may vary in the number of days apart. So on average, and we say average meaning most of the time, but maybe every single month is not the same. So it may be 28 days is the average period. But some months it could be 25, some months it could be 29, some months it could be 27. It could differ a little bit. And so that may be a reason. Also, I see sometimes just with the way the calendar year is, like different months like February that's shorter, or other months that has more weeks, the time that we think it's going to come
Right.
on, the weeks may match, but the dates may be different. So when you're looking in your app, you're like, oh, it's a week different. So sometimes that could be a reason too. And
Right.
then other times it could actually be something that's going on that requires lab testing or ultrasounds or a
Okay.
physical examination to find out. That can be pretty common. I've seen that a lot. The main thing is to definitely go be evaluated, get checked out. And then if everything comes back clear, then you can know that sometimes our periods just could be wonky, as I like to call them. But definitely, if you're skipping months, like you'll have one in 1 month and you'll go 2 or 3 months and not have one, then that is something you definitely want to go and be seen for as well.
Right. I noticed that with myself too. Like, I noticed like in the beginning of the year, my period might be earlier in the month, and then as the year gets later, it's
Mhm.
like closer to the end. So yeah, it does kind of fluctuate, like
Yeah.
because of the calendar year, the days and stuff like that.
And age also sometimes has something to do with it. As women get older, so specifically for women like in their 40s or in their 50s, I always like to call those the interesting years, because that's typically when perimenopause at some point is going
Uh-oh.
to come on. We don't know when it's going to come on, but we know at whatever point in time is going to come on.
Yeah.
And so you may start to see some changes in your menstrual cycle as your body slowly kind of walks its way towards menopause. And so it may change and come at different times of the month. And then it may start to come some months and not come at all. And then at some point, it will not come at all. The average age is 51. Some women are earlier, some women are later. But all that to say, sometimes age and where you are on the developmental timeline, that can also be a factor. But again, go get seen, go
Right.
get checked out,
Right.
make sure that person's asking all those important questions so we can figure out what's going on with you.
And
Right.
my question is, because I'm currently married, we have one child. I don't want to be on birth control because I'm scared of the effects they might have years later. Like what? I'm not. I don't know that many birth controls options out there, but I know I'm not a pill taker.
Mhm,
I know I'm not gonna be every day taking a pill. I'm scared of the
mhm.
one that they put in the arm. I'm not sure about the one that they place inside you. So, is there any birth controls that you recommend that that will be safe to take for somebody who's like kind of scared like
Yeah.
me?
No, and that's a great question. Whenever we're having the birth control conversation with them, there's lots of thoughts that go into that. Um,
Mhm.
what's your life like? How many children do you have? Do you want to have children? There's no point in having a 10-year birth control and you want to have kids next year.
Right.
Or if you want to have, if you know you're done having kids whatsoever, then maybe we can talk about those type of things. So again, finding out your individual risk. And then just like you said, what do you feel comfortable with? I've had lots of women say,
Mhm.
this is cool with me, not this, or
Right.
I'm excellent at taking pills. I would do better than that than using like a vaginal ring, for example. So I like to find out what makes you tick. I don't remember to take pills all the time, just being completely transparent. Remember to take my vitamins, prenatal vitamins for my hair, skin, and nails. Sometimes that's hard to remember. So
Exactly.
long-term things,
Yeah.
they strike my fancy. Other patients, they said, no, I am meticulous with it. So all that to say, there are some methods out there that do not have any hormones. And so there's an IUD that's actually 10 years, doesn't have any hormones. Again, it's an IUD, but what I like to do is I like to explain, this is what it looks like. This is how big it is. If you put it in your hand, this is how big it is. Here's a sample. Feel it, feel the strings. Just kind of at it in a perspective that you may not have looked at it before and see if it's something you're comfortable with. If you're not comfortable, cool. Again, there are over-the-counter things like spermicides. We have things like we used to call old school, but they still very much work. They're still very much effective, like diaphragms and other barrier methods as well. There's nothing wrong with condoms either. Some married women and men, they're okay because the main goal is not to get pregnant. Some women and men say, nah, I'm not having that. So again, it depends on your family as well too. But there are some options, and the thing that I like seeing is that they're coming out with new things too. So every couple of years, we're learning about another option that's easier for some people that may not have been there before. So there are a couple of things that you can consider.
Okay, because I'm gonna look on your website because I don't currently have a doctor where I'm at. I'm in Maryland.
Okay, yeah. So set up a consult and we can have a whole conversation.
Yes.
I'm looking forward to you connecting with some doctors here in Texas.
So for people who just couldn't on, can you tell a little bit about is it Coceaux?
Yes. So it's Coceaux Health. Essentially, we are in the business of providing telehealth services for specifically women of color, just because of all the disparities. So I want to be able to give access to women. We're all about convenience. So we offer all of our services. Trying to get my phone, on the phone, you could do them that way, or you can do them on the computer. Visits are very short, very simple. But also we're in it for education as well. So we have our blogs, we have content, we invite guest writers to come on board. And we just want to close the gap with disparities. So that way we can give women the care that they need in a way that's convenient for them. And also we believe that representation matters. So we are really in the business of trying to pair women of color with providers of color. So that way it's a comfortable environment. You feel heard, you feel seen and understood, and you know that the person that you're seeing, they may have a similar experience as you too.
Right. So audience, we just want to let you know that Dr. Shaughanassee, we have her here tonight answering all your questions from Coceaux Health and virtual network, you were saying, for healthcare for women of color. So if you have questions, don't be shy. Ask your questions. This is your perfect opportunity to ask questions. If you need to go to the doctor, if you're kind of nervous, you don't know what to say, this is your opportunity to ask questions. I know a lot of times with women, when we go to the doctor, are there certain questions we should be asking when we go in for our annual appointments? Are there some things that we need to be asking about? Because I know sometimes we talk about like hormones and different things like that. Like you said, when we're getting into our 40s, making sure that our estrogen levels are balanced and things like that. Are there certain tests that we need to be asking for?
So I always think it's good to, first of all, when you come into the visit, or even before you come into the visit, when you're at home and you have questions that you're like, oh, I should ask that, write it down. I am the queen of, I pull up my phone, the notes section, and I write it down. And then when you come into the visit, you don't have to think, I had a question last week and I can't remember what it was. You can just ask that. So any question that you have, write it down. And most people will be happy to answer that. I think it's also important to ask about screening tests because some people can overlook them, but they're very important. So the purpose of screening tests is to just kind of see if there's any risk for infection. The goal is to not necessarily treat you when you're sick. Yes, we do that, but we want to keep you healthy. We want to prevent you from getting sick. And so the key to prevention is to do the screening test. And as we are in different timeline or ages on the timeline, rather, there are different tests that are pertinent to us. So I think it's important just to ask, what am I due for? because of my age, what screening test do you recommend? For example, if women are younger, we want to make sure that if you're sexually active, that we are keeping on track of those screening tests to make sure there's no STDs, there's no HIV, there's nothing else that would concern us there. Other women maybe on the timeline to let's talk about mammograms, let's talk about colonoscopies. The pap smear is always a popular question. When am I really due? Do I get it every year? Do I get it every 3 years? All those different questions. So I think that's an important one to ask as to what screening tests you should be getting for what age you are and where you are on that timeline. And just any question that you may have is an important question. So when you think of it, write it down and then just bring it in there next time. And even if you have like a laundry list of questions, and we do have time. I respect my patients' time. People have to get to work and do other things. I love saying these are some really good questions. Let's set up, a patient portal where we can go back and forth and answer those things. Or let's pick the top 3 questions that you really want to know right now, and then let's bring you back and we'll ask some more questions. And so we can do it like that as well. But the main thing is to make sure that you get your questions answered.
That's awesome.
And we have a few more questions for you that came in. So the first one is, do you offer services across the country?
So we're working on expanding right now. Our patient base that we are seeing is out of Virginia and Maryland. Very soon, in the next few weeks, we'll be adding Georgia, and we'll be adding Illinois as well as California. And then as soon as we meet other providers in other states, then we're going to be expanding. So keep up with our website and with our social media, and then we'll definitely be letting everybody know what state we're in and to have the ladies come on in.
Okay. And here's the website that we're going to put up.
The next question is, after menopause or hysterectomy, how often should we go for vaginal exams?
So I always tell people, definitely keep your 1-year appointment. Your 1-year appointment is, first of all, if you have insurance, it's typically that appointment it's free. Your insurance will cover. Most of the labs are covered too. But also, I like to think of it as this is our check-in visit. So many things could happen over a year: get a new job, have more kids, have a new partner, have a new spouse. Lots of different things could potentially happen. And your body can also go through different changes too. So even if you've had a hysterectomy and you say, well, I don't have a uterus or a cervix to even have a pap smear, there's still so many other things that we can do at that annual visit. We can do lab work. We can talk. If you need to have a specimen collection, if you're due for another screening exam, we can order those things. So definitely, I would say once a year, regardless if you've had those procedures or not. And then also, if you just feel like something's going on and you want to be seen, call and make an appointment and be seen.
Awesome.
And our next question. Do IUDs get weaker during the 5-year period?
So actually, it depends on what IUD is present. There is a 10-year IUD. So of course, that one lasts for 10 years. That's a hormonal free. And there are some that last for 5 years. So we say that it lasts for that amount of time because that is the amount of time that the FDA has approved it for, meaning when they did all the research on that particular medication, that is the time period that they researched. So we can't say with 100% certainty that if you keep it in longer, that it's going to get a little weaker or should take it out earlier. That's the main question I get with a lot of the long-term method, the 3-year method, the subdermal implant that goes in the arm, and the 5-year IUD. Should I get it taken out a little bit before? Is it still going to work? So if it says 5 years, then the research shows that we know it's going to be 5 years. In other countries, some people have tested it where they've kept it in longer. But again, it's just knowing that when you keep it in a little bit longer, you're potentially taking that risk of not being covered for all the benefits that the IUD gave you at the time.
That's good. Great information. Wow, such great information, ladies and gentlemen, whoever is joining us tonight. We are so grateful for our audience on Bougie Girl Cyber Happy Hour on this Monday night for Healthy You Corner. And we have Dr. Shaughanassee Vines with us from Coceaux Health, and she is answering your questions if you're scared to ask your doctor or you don't really know what to ask. And so she's answering those questions. So we are just grateful for your questions on tonight. We are excited to have her with us. It's been a pleasure. We are so grateful. We're honored to have you. So, Elena, you have any other questions, or I don't want to take up all the questions?
You always, she's the question asker. I'll always just listen. So, I don't know, because I've seen, you pretty much answered it. That's why I'm like, all the questions I had, you was answering them. But I don't know if you've seen a picture of the baby who came out holding the IUD in his hand. I don't know if that was real.
I don't either. I think there's a lot of skeptics out there. Who knows? In the era of Photoshop that we live in,
Yeah. But are there any birth control that still have a percentage that you still can get pregnant? Is there a small percentage, or they all pretty much will prevent you from being pregnant?
I always like to say this: nothing is 100% effective. I mean, unless you get a surgical procedure that removes parts of your body, that removes the reproductive activity, then that's the only guarantees you may be able to have. But with any contraceptive method, medication that you may take, there's always a small percentage. Now, the good thing is that percentage typically tends to be relatively low, depending on what method it is. The IUDs and the implants in the arm, what we call those are LARCs, long-acting reversible contraceptive. The good thing about those is that it's not permanent. If you decide 6 years down the line that you want to have another child, you are able to do that. But if you decide, I don't want to have any more kids, you can just get another one. But the good thing about those is that because they stay where they are and they remain in place, and there's always a steady release of either the hormone, or if it's not a hormone, the product that's there, then I'm losing my train of thought. There's not a risk of like missing pills, for example, or forgetting to put a vaginal ring in. Right. So there's less room for human error, is what I wanted to say. Right. And so those things are more effective, not necessarily because they work better, but just because they eliminate some of that human error. Things with pills can be very effective, but it's people that forget to take pills, like myself sometimes, or other people. Things happen in our lives where we forget to take them, or you may forget to insert your vaginal ring. So all of those things, they can make birth control methods slightly effective. So I like to just tell everyone nothing's 100% effective, but the more intentional you are, the more conscious you are, then hopefully the more effective it can be. But there will always be people who are in that 1 or 2% where I got pregnant on such and such method, and it happened.
Yeah. So you mentioned on your blog, keeping your cervix free of cancer. Can you talk a little bit more about that? Because I know that's a heavy issue, I'm sure.
Yeah, the main thing I wanted to do through that post is I wanted to encourage pap smear screening, like we had talked about before. Screenings they're important. Sometimes I think it's easy to kind of brush them under the rug and say, oh, I haven't been in a year or two, or, 2 years becomes 5 years, becomes 10 years, becomes 20 years that you haven't been to see anyone. And so with cervical cancer, that is what we are screening for with the pap smear. And so again, coming in once a year, just to have that annual done. If you are due for your pap smear, then you could have that done. If your pap smear was normal last year and your healthcare provider says, we don't have to do that for another 3 years or 5 years, then at least you know that that you've done what you could to make sure that you've screened and that you've maintained healthy. So getting your pap smear is important. If you're not married and you have different relationships, being monogamous is important. And also just making people aware of the HPV virus that is very common nowadays. There are vaccines that are out now that can help prevent against that. So I like to think of it, if there was a vaccine that could kind of really cut the chances of me getting a cancer, I'd be down for that. Just me. So that's what those vaccines do. They help to decrease that risk of cervical cancer and other cancers that HPV can cause. But just bringing awareness to the fact that people, again, go be seen, go get screened, have those conversations with someone that you trust, so that way we can make sure that you're on the proper timeline.
Right. So when my children were younger, like teenagers and different things like that, for my son and my daughter, I had them get the HPV vaccination that they had. Is that something that you recommend for our children to have that, or is that really like something that people are just trying to make money from? What do you recommend for that?
I think everyone has different opinions about all kind of vaccinations. Some people love
Sure.
the flu vaccine, and some people can't stand. So I've seen the same um, attitudes when it comes to the HPV vaccination.
Mhm.
I typically deal with teenagers on up. And
Right.
so we educate. We can't make
Mhm.
anyone become
Sure.
vaccinated, but it's just going over the risk and the benefits of it. And so in my particular population, we definitely have that conversation. We let people know that you're able to get it up till age 26. And so if that is something that you feel is going to be protective for you and preventing those different conditions potentially down the line, then we advocate for you to get that.
Awesome. Also, both of us had this question, I believe. We anemic. I've been
Very much
anemic
so.
from for all my life. With the low iron.
I know.
My fingers turning blue.
Mm,
I'm sitting here. Trying to take iron pills, but then they have other side effects. So it's like I only take them for maybe a week or two before
right, right.
I can't deal with this. I have too much going on. So, is that common? Have you noticed that common for women, or how can we help alleviate that without taking those pills?
Yeah. So first of all, there are actually different types of anemias. So when people say that they are anemic and they haven't been to see anyone in a while, I'll always say, again, go talk to someone that you trust, go get checked to make sure that you are getting the right treatment for the right type of iron,
Sure.
anemia rather. Because if you're not iron deficient, you may be taking iron and you don't really need it. It's something different. So all that to say, go speak with a primary care provider about that. Now, if you are iron deficient and that is type of anemia that you have, those pills, they have some side effects. Well, really, it's hard to go to the restroom in particular. I hear a lot about constipation for a lot of women. And so when
Mhm.
medication gives us side effects that we don't like any person, we just stop taking them. So
Right.
different things that you could do to maybe increase your iron intake are ask your provider if there's a different type of iron that you could take. First of all, some
Mhm.
irons are a little bit more easily digested than others. They have less effects on your stomach, I would say.
Mhm.
So for example, I know there's one particular one that I may like to give because I've heard so many patients say that it's a little bit easier on their GI system.
Right.
Um, if you are able to, then I always tell people again, diet, making sure that you're eating foods that have high in iron. So making sure that you can even Google search,
Right.
people will often ask for a list. Sometimes Google is great, sometimes it's not, but for these things, it is pretty good where you can go up there and just say high iron foods and just try and eat those. The
Yeah.
thing in my household has been the cast iron skillets lately. And so we cook in those just because they cook really well, but also some of the iron in the pan just becomes absorbed in the food as well too.
Oh
So it may
wow.
not fix all of the deficiency, but again, another way to get it in there. So if you can ingest things that have iron in them, then typically that's the best method. Sometimes our diet just doesn't have enough or our body's needs outweigh that. So then taking an iron, but they have liquid forms, they have different types of tablets. So exploring what other options are out there. So again, asking questions and saying,
Right.
hey, is there something different that I can take? And there probably is.
Okay. So maybe, for clarity for myself, you're saying there's different types of anemia. It's not just an iron deficiency. What are the other types of anemia that's there out there?
So actually, there's a whole other medical
Okay.
specialty that is
Okay.
dedicated to just that. We could go all day. So if you
Oh
know
wow.
that you don't have enough iron, then that means that you've gone somewhere and you've been tested
Yeah.
and had that talk.
Right.
I hear some people just say, I'm cold all the time. I'm tired. My iron must be low, but they don't ever call and actually get checked to see if that's the issue or if it's something different. So if you haven't, then go make that appointment, get some labs done, talk with the healthcare provider and see if that's the issue. And then if it is the issue, then yes, there are different medications that you can explore. There's dietary options that you can explore. And then sometimes it's just plain old, we got to take some of this stuff too. It's kind of like feeding our kids vegetables where it's good for them and you just don't want to do it. So
Yeah.
sometimes some of our medications can be like that too, where
Yes.
I know I got to take this supplement. let me just go ahead and take it and set a reminder on my phone or something like that too.
Right. Yeah, because I was just wondering because I know a lot of times, I'm like, oh, like I was mentioning to you before, I'm cold, my fingers turn blue, and I'm always cold, even if other people are hot. It's like, okay, I know, but I've had an iron infusion also, so I
Yeah,
know
yeah.
that is something that they have told me that I've had in the past. So I was just wondering.
Mhm.
I know you said that's one type, so I was like, wow, I didn't know it was different types. So yeah.
I think I self-diagnosed because every time I went to go give blood, my iron was low. And I'm always cold. Like, I grew up in Louisiana and Texas. I moved to Texas when I was a little older. And even in the summertime, I ride with the heat on. Like, I ride with the heater on in my car all the time.
Okay, okay.
It's comfortable for me.
Yeah,
Yeah.
yeah. And so, and sometimes there are things as women that we could have. If we have heavy menstrual periods, for example, and you bleed a lot, then that could add to some of those anemias or not having the iron. But definitely, if you're questioning it, if you've never been seen or talked to your healthcare provider, have that conversation because there can be different things that make people feel cold or make them feel tired or make them feel short of breath or some of the other symptoms that we may see too. So like I always say, it goes back to having that relationship,
Yeah.
talking to
Right.
someone, making that appointment, and then
Right.
asking those questions.
That's
Yeah.
good.
And I'm gonna get one because I haven't since I moved to Baltimore. I've been to Baltimore 8 years, and I haven't had insurance every single year. So it's been on and off. Luckily, the year I got pregnant,
Yeah.
I had insurance. But yeah, I just haven't found like a good doctor here. And usually, like before, I really just went to where my mom, because she's a nurse, and she'll just say, "Hey, go to this person." But I never felt like I would go there for something else and I'll have questions, and it's like they don't care about the other things I'm asking for as long as that they take care of what this is.
Mhm.
Right.
Yeah, yeah, that's huge. That's huge. And definitely, we're hoping at Coceaux Health to address some of those issues too,
Yeah.
because typically most women of color or people of color, there's a barrier to care because of issues like you mentioned with insurance and other things. Typically, the jobs that people of color may have may not offer those great benefits that we need to be seen by other people. So
Yeah.
I think we as a healthcare system, we have some work to do.
Yeah.
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 Right.
And I also know, like, since because I had a C-section,
Mhm.
and I don't know, I've just started talking to other women who had C-section because I always felt like I still felt like phantom kicks, and I can feel
Mm.
like movement
Mhm.
down there, and I get scared and I go run and take a pregnancy test. I'm like, this can't be, but I keep having it, and they keep saying they don't find anything. But I'm like, is that something I should be concerned about? Like, I keep feeling like movement. Um,
Hmm.
I guess in my uterus. I don't know, wherever.
Yeah. So I mean, definitely, like you said, having that appointment because some things just need to be seen and touched just to feel. But even in pregnancy, having conversations with women, or actually before pregnancy, just about birth and birth options, knowing what the indications for vaginal delivery are, knowing that that's what we start out wanting to do, vaginal delivery, and knowing that sometimes C-sections happen, and these are the reasons why C-sections may happen, and these are some of the reasons why it may be easy to have a C-section, but maybe that's not the best route to go. So again, having that conversation.
Yeah.
But like you said, I think that's very valid. I mean, a C-section is a major abdominal surgery. And
Yeah.
so just like after any surgery, there may be some side effects that are a little bit more long lasting. So
Okay.
again, I just think it's so important to listen to people, hear what they're
Mhm.
saying, not to dismiss it, make it sound like, oh, that makes no sense. But
Right.
it makes sense because obviously we had to perform a surgical procedure. And so you may be having some residual feelings after that. And
Yeah.
sometimes our bodies, they just don't go back to the way that they used to be. Doesn't mean that they didn't heal. It just means we have a new normal now. And so
Yeah.
listening and hearing what women are saying, and then talking about what we can do from that point forward.
So my
That's
next my next question is allergies, because I know I've developed uh, seafood allergy, shrimp and crab when I was 20, and then when I turned 25, 26, I can no longer eat apples or pears.
oh
Is
wow.
so I don't know if my body's just going to keep rejecting things, or is there things that I can do to kind of reverse the effects of the allergies? Do I have to detox? Like, what can I do to be able to not have these particular allergies, or are they permanent?
Yeah, and so I'm not the specialist with allergies, but what I always first of all tell women is to make sure that you have a good primary care doctor. Many women have a specialist, so they may see a midwife or OBGYN or a women's healthcare provider, and then all the other parts of the puzzle aren't necessarily there. And so if we have a primary person, they're kind of like that hub or that
Yeah.
center of the wheel spoke, and they could help do the referrals. And so for someone like you, what we may say, or what I may say is, well, I'm not sure of the exact answer for this. I know that things can change as we get older or during our lifespan, but I do know someone who specializes in that. Let's get you over to a specialist for that. Let's get you over to have some allergy testing. Let's get you in the right place that you need to be. And so I would say, if anything, to start with that primary care person or that person that you trust. And like you had mentioned about asking questions, that would be a excellent question to ask, because I may not think to ask you that or to have those conversations if you don't make those things known. And then I said, oh yeah, we can get you over to a person that's all that they do. And then, it just completes the puzzle even more.
Yeah.
Awesome.
Good. Thank you.
Well, we are so thankful that you were able to join us. If anyone has any last minute questions, because we want to let you have your evening back, please ask Dr. Vines your questions in the comments. She
Sure,
is
thank you.
Thank you.
our audience is saying thank you. You have been a wealth of information on tonight in regard to women's health, especially women of color and things that we need to do. So please make sure that you go to her website, make sure that you um, go on there and just research and see what she's saying on there, and then maybe reaching out and asking questions, following her on social media, on Facebook and on Instagram. But Dr. Shaughanassee, this has been a blessing for you to be on here with us tonight, to just take the time out of your evening to answer our questions.
Yes.
And we're just super excited to hopefully have you back again to talk about some other poignant issues. But this has been a blessing. So thank you so much. Do you have any last minute tips or any last minute comments that you would like to share with our audience before we log off?
I just want to say that the questions were excellent. Thank you so much for thinking of me and for having me. It was definitely my pleasure. Like I said, if you are in need of women's healthcare services, we are expanding every day. So please visit our website, www.coceauxhealth.com. Like us on Facebook, and we're revamping our Instagram. And then also, it's a place for content as well. So if you are a blog writer, or if you'd like to write, and there are different topics that you want to write on health-wise, then you can go to our website and you can also submit those too. So you can be part of that information list. And again, if you are other providers of color out there, we're looking for providers, so that way we can expand across states and we can touch more women and touch more families. So reach out to us for those concerns as well. We would love to be in contact with you.
That's awesome. Well, thank you so much, Bougie Girl Cyber Hacker, our audience, for joining us on tonight. Thank you, Dr. Vines. And you all have a blessed evening. Thank you all
We
so
have
much.
to ask her. You didn't ask her.
What?
Our
Go ahead.
Our bougie
Go ahead.
girl.
Okay.
So every
I'm sorry.
every guest that we have on the Bougie Girl, we ask them. So what Bougie stands for is bold, one of a kind, unbothered, which means we unbother what people may think about us. We're God's girls. We're intentional and we're elegant. So we ask all our guests, how do you? Which part of Bougie do you feel like best describe you?
Could you say that one more time? I think I liked all of them.
Bold,
All of them.
bold, one of a kind, unbothered, God's girl, intentional, which I have the shirt on today, and elegant.
I think God's girl, intentional, and elegant are my favorite. I'm not supposed to choose one, but if I had to have one, I would say God's girl, because I think that's the foundation of everything. The knowledge, the gifting, the relationships, the favor, all of that. Everything stems from that. And then, of course, just being intentional with everything that I do. And I like to be elegant when I do it.
You might as well have a little elegance or a little swag with it when you do it.
Yes.
So why not, right? So we like to look cute as doctors. We should look shabby, and you want to have on your lipstick, have your hair done. We see you on those pictures on Instagram, so we know you do it. So it's like, okay. And we love to see that, as Black women, just because we're on our jobs, we want to look nice at all times, no matter what we're doing. So we are just super excited. We love to support women of color and what you are doing, how you're being a blessing to our community. And this channel, the foundation of this channel is just to support women of color, to support women and provide them with tools and information. And so you have definitely provided us with tools and information and tips on how to be better and healthier as Black women. So, like we said, Bougie Girl stands for bold, one of a kind, unbothered, God's girl, intentional, and elegant. So we know you're all around Bougie Girl. So we are so thankful for you being here on tonight. So
Thank you so much.
Yes,
thank you all.
and for everybody who's looking for a shirt, we are selling the shirts. They're on sale. This is actually our workout shirts or the tees, the summer tees, and they have a razor back. I got mines today, so I'm excited. And I have the God's. I'm
Yay.
God's girl bougie, and I
Uh,
also have my intentional one. But you can find all of our shirts on our Teespring um,
store.
store.
And
That's
then we
it.
have mugs on there. We have all kind of goodies. So if you want to go and support, please do so.
Yes.
Awesome. So Dr. Shaughnessy, don't log off yet, but everyone else have a great night. And thank you for joining us. We love you all. Be safe. Bye,
Bye.
everybody.